2 minutes past the hour, so that's the official kickoff time for us today. So good morning, everyone. Morning, afternoon, or evening, depending on where you are. My name is George Margelis. I am the independent chair of the Aged Care Industry Information Technology Council. My great pleasure to welcome you and our speakers today for this informative webinar on digital maturity in aged and community care, work being done by the council over the last few months. First of all, I'd like to start off by acknowledging traditional owners of the land upon which we meet. I'm based in Sydney, so I'm on Gadigal land. For those of us in Australia, spread across the country, we acknowledge the traditional owners and the custodianship of the lands on which we meet, and we pay our respects to their ancestors and their descendants who continue cultural and spiritual connection to the country and recognise their valuable contributions to Australians and global society. So before we start, a little bit of housekeeping. As this is a webinar, all your microphones have been muted. If you have any questions about the event, please feel free to use the Q&A panel at the bottom of your screen. Click on the little Q&A button and enter your question there, and we will endeavour to answer that question during today's webinar. Again, if you have any issues or technical issues, please also pop anything up you have into the Q&A as well. Next slide, please, Georgie. So a brief introduction to the Aged Care Industry Information Technology Council. I do note that we are probably amongst a few friends, but just an update. The council itself was established formally in 2007, although it had been in operation for a couple of years beforehand as a joint venture between the two peak bodies at the time. And its focus is on harnessing innovation and technology to help create a sustainable and high quality aged and community care sector in Australia. We focus on three particular areas at the moment. We're looking at promoting good analysis of the area and the use of technology in our sector, looking for and providing resources to develop research-backed evidence that demonstrates the value of technology in our sector. And ultimately, this is all focused on promoting improved outcomes for both the clients who we provide services to and the providers who provide those services. There are a number of areas in which we're working at the moment, and we could spend a day going through all this, but the reality is we've been looking at, as we are today, at digital maturity, clinical systems, workforce issues, integration, the overriding reform agenda happening in Australia. Peak in everyone's mind now, the use of artificial intelligence and how it relates to the use of to delivery of services in aged community care. We've been looking at how we can enhance on our 2017 roadmap to enable people to have a better understanding of how they use technology. So overall, we're focusing on multiple areas that add value to the use of technology in the sector. And we're doing that with a strong co-design process so that we're working with the providers and the recipients of care to ensure that the services that we are focused on are providing increased value. Bit of work on our most recent activity. So you may have seen released earlier late last month, our focus on clinical care systems of residential aged care. It got quite a bit of attention. We looked at what the current status is of aged care technology systems in residential aged care, and we do support the Australian Digital Health Agency for their support in that project. The report did find a number of interesting findings around the lack of integration, the complexity, and the sheer number of systems in use in residential aged care. And before you do ask, yes, we are looking at in the future also repeating this in community care systems, as we understand that is a particularly challenging area at the moment. You can download that report by either scanning the QR code or going to our website, where you'll be able to get a link to that report. Another very important piece of work which we've been focusing on over the last few months is the issue around data standardization. So not just the technical standards around the delivery of packets of data, but more particularly around the processes and the guidelines around the use of standards in data collection at the moment. To do this, we actually did some work in conjunction with the University of Queensland Centre for Health Services Research, looking specifically at geriatric assessment programs and how those are used, what the standards are around their adoption and their evidence around their value creation. And again, comprehensive reports available on our website, either by scanning the QR code or going to our website. But that work has been critical in helping us develop a standards base across the entire sector going forward. Also, quite recently, we've been working with the Australian Digital Health Agency and the Aged Care Quality and Safety Commission, looking specifically at the use of My Health Record in aged and community care. The focus has been initially around residential aged care, and as you've heard from us in previous webinars, that's because of the current focus from the Digital Health Agency. Again, we do have plans to look at community and home care services going forward, but we have released the My Health Record guidelines for residential aged care, and again, link on the link on the QR code, or again from our website. And new version of that is due for release on 28th of November. I do suggest you definitely get a chance to have a look at those. The use of My Health Record as an integration tool across the aged and healthcare sector is a critical first step in our digitization process. So whilst we've had a long journey with My Health Record, aged care now is an integral part of that journey, and we've been working closely with the agency to deliver on that promise. So again, download the reports there. You can watch the videos on our YouTube channel, and it is a very positive step as far as the integration of the health and aged care services in Australia. Bit of a small brag for us here. So we're happy to announce that last week or so, we were announced as the winners of the 2023 Future of Aging Awards in the category of service transformation. We do thank everyone who voted for us for that award, and for Inside Aging for that award. Really is a culmination of many years of work to help the industry in its digital transformation journey, and we look forward to continuing that endeavor going forward. So again, thank you to those who voted for us, and thank you for those providing the awards. We do have opportunities for questions and answers after this session, but for now, I'd like to hand over to Anne Livingstone, our Executive Officer, for an overview of the digital maturity in Australia and Aged and Community Care report. Over to you, Anne.
Thanks, George, and hello, everyone. I'm going to just take you through quickly the work that we've undertaken recently around a national survey of digital maturity. So in today's session, I'll talk about the survey and how it was constructed. I'm going to lead you through what we developed in terms of, I think, a lasting digital maturity toolkit, and how this toolkit could and hopefully will assist providers in benchmarking their services nationally and indeed internationally, and we'll talk about some of those opportunities. But how we as an industry and individual providers can look more strategically at their roadmap and investment to ensure that we have a future state of higher levels of digital maturity in the sector. So I need to acknowledge the funding that we received to do this through the Australian Digital Health Agency, but I also need to acknowledge fully our partnership with Columbia University, particularly our partnership with Professor Greg Alexander. We've had the privilege to work with Professor Alexander on a number of projects and acknowledge his international reputation for a leading researcher in this area. It's been wonderful to have you on board, Greg, on this project, and I know we're going to hear further from you later in today's session. So what was the survey that we undertook? We brought together much of the work that the council has done over the last couple of years, and George did mention some of these, but I'll particularly call out that this survey builds on the work that we've done around the technology roadmap, specifically the gap analysis we undertook after we released the roadmap, and also the landmark study we did just on the cusp and during the start of COVID in 2020, looking at the capabilities and readiness of the sector. We call it the Care IT report. And then more recently, as George just indicated, we've released our work around clinical systems in residential care. You can download these from our website, and I think that the four of those activities really add to the landscape of work. But what we really did in terms of this survey was draw out the work from the Care IT survey we did in 2020, and also the work that Professor Alexander has extensively developed over many years, both here and in other countries. So for us, the purpose of the report, in terms of digital maturity, we drew on Kane and his colleagues' definition that digital maturity is defined as the organisation's ability to adapt so that it can function effectively in an increasing digital environment. And the purpose of our work was to deliver to the industry and to the Australian Digital Health Agency a point-in-time view of where the digital maturity of the sector landed. So the purpose of this was also to build an assessment framework that could live for other projects. And we used a range of co-design and consultative processes. And I'll call out later individuals from the National Roundtable of the Council who helped us in this work, and have continued to help us in the work in testing the results as well. And the findings of the national survey will be released next week, and hopefully they'll provide a benchmark on which aged and community care providers can really have an inside view of their operations, but also have an opportunity to assess their organisation's performance against performance of the whole of the country. So the report that we're about to release is going to give you lots of information. It's going to show you the information drawing on the models that I've mentioned before, but it also will draw on the work that Professor Alexander has done in, particularly in the United States and Canada, and early work as part of his Fulbright scholarship in Australia. So what did the survey find? We had over 170 aged care providers complete the survey. We would like more, and we're hoping that this isn't a one-off survey period. We also need to note that during the survey period, it was a really heavy workload on providers, and it was a period where a lot of other surveys were going on. So I think the net effect was that we didn't get as many who answered the survey, but for those who answered, there were 792 unique facilities, which covered over 57,000 residential care places. The survey was divided into two parts, and the first part, you can see the sections on your screen now. The survey B included the work of Professor Alexander's. So the respondents, they represented, as I said, 57,000 clients, but also it also really clearly, from our analysis, provided a representative spread of industry participation. For example, we had large multinational organisations respond down to single two-man operations in rural areas. But we do acknowledge that we did have those problems. Compressed timeframes made it difficult for us, but also we struggled with many redundant department databases, and that was had a net effect on. But in the end, you can see from this slide, we had representation from every state and territory. So what about the survey? Let's go straight into what the survey results indicated. On average, the score overall and nationally was 58.4 out of a maximum score of 109. So you can see that we've got a long way to go, but there were variations in respect to the location and the size of the provider. We're hoping to do more analysis on this, and hopefully with a larger survey sample in the future, we can add to this work. But where were the strengths? Some of the strengths we identified were in improvements in cybersecurity, and particularly cybersecurity where policies were in place and the technology had a measurable impact. We also found that free Wi-Fi and video conferencing and broadcast messaging had greatly improved, and that shouldn't be a surprise, I think, to anyone, given our rapid digitalization over the COVID period. It'll be interesting to see if all of those facilities are able to be maintained. We also found some great examples of improvements in business continuity and particularly disaster recovery. And digital leadership was interestingly identified as being strong at board level. So we know that a number of people involved in the work of the council have increasingly focused on skilling up their governance. And we saw this was particularly so in residential care survey respondents. But we did find some weaknesses, and I'm going to report fairly quickly on those. We did find that the self-reported level of innovation, and we did ask some direct questions about the use of robotics, AI, digital apps, monitoring devices, etc., was indeed very low. We know that the evidence is increasing that some of these technologies have great potential to assist the sector and to personalise the care and support of older people. So we're hoping that we can see improvements in that in the next round of surveys. We did find weaknesses in client and centred and resident-centred access to their own digital records. And we believe that this also provides great opportunities for providers to focus in on this area. Sadly, we found data analytics was low and that was not being used to any extent to predict or improve care. I guess, George, we've got a commitment to ensure that the data collected is able to be used very proactively. And some of the work that George indicated earlier in our digital standardisation work will hopefully contribute to more user-friendly data. And we did find some weaknesses around cybersecurity insurance and the protection of data. Very concerningly, 25% of our respondents didn't actually know whether they had any cybersecurity, and the safety of resident and client data was seen to really be needed to be improved. So what does it look like in a snapshot? So we looked at a number of areas that are on your screen now. IT compatibility, people skills and behaviour, governance and strategy, interoperability, data analytics, cybersecurity, and the focus on resident and client-centred care. We then did score the results of each of those. And for example, there's an example score in the next column. The average score of all participants across those items. And then the average, you can see there, of residential aged care providers and large providers. And you can see the potential of the maximum score at the end. So I'm just going to lead you through individual elements of this fairly quickly to give you an indication of, for those individual organisations who submitted survey data, we're planning to give this data back to them, and that should be coming your way shortly. And it will look something like this in terms of giving you what the average score, the maximum possible score, and how your score will be constructed. For example, in IT capabilities, we looked at software, communications technology, and innovation. With people skills and behaviour, same sort of things, but you can see that we also are in each of the areas of giving information on the strengths, the weaknesses, and the concerns. Same again in governance and strategy. So the maximum score varies for each of these. So it's important that when you do get your scores, you do keep abreast of what the maximum score is and what you got. And I guess for us, the strengths and weaknesses and concerns are probably going to lead you to strategically look and plan for improvements. Same with interoperability, you'll see it's a score out of 12 there, and some comments around external interoperability and internal interoperability. We do see some weaknesses there, particularly with the interoperability of government software. In data analytics, as I said, that's an area where we identified that not many organisations are really making any use of predictive analysis to improve the care delivery. But we do know one of the strengths, if you can call it that, is that we actually do collect a lot of data. The weakness is we actually don't use it. So we're hoping that there'll be some great improvements and showcasing of some great examples of how people are using their data to improve the way that services are delivered and the way that they are resident and client centred. So I know George is going to mention again ACIITC at the end of this presentation, but we hope that we will be able to share a lot of this, really some good examples both here and overseas. So cybersecurity, same thing, score out of 18. This looked at protection practices, policies and processes. In residential and client-centred care, this is an area where great improvement would be made. The average score for resident-centred care, as we called out earlier in the weaknesses, was 4 out of 12. In that, we looked at the average data client input and the accessibility of information to clients and residents. We did overall find some improvements, and I'm just going to report on those improvements. We did find some improvements in protection software. You'll see a slight increase. We also saw more staff having access, a stronger use of video solutions for communications. Interesting thing will be to, as I mentioned earlier, to see if that continues to grow after COVID. And more organisations having a cyber security than we found, for example, in the Care IT report. And it's great to see at governance level, there's a real focus and a trend towards recruiting people with digital skills, digital strategy skills and digital governance skills. But again, we think that there's a long way to go. As part of this project, we developed a toolkit, and this was really a two-stage approach. We looked at all the existing toolkits. We undertook some co-design with some industry experts, and we also really considered a range of feedback about how this toolkit could be of the most benefit to providers in their day-to-day work. So the toolkit components were benchmarking, guidance for developing a strategic approach, and identifying priority areas for attention. So that toolkit, clearly we've had some feedback. We've already tested the scores, and we've already tested some of the results with individuals who participated in the survey. We've got some great feedback about how useful the survey tool and the toolkit are. And we hope when we release the whole of the results to the 170 odd organisations, that we'll also be building a body of knowledge from their feedback. The benchmarking really is about providing a clear understanding of the current digital maturity. It is for us about the opportunity to benchmark nationally, but the opportunity also to benchmark internationally. The toolkit also is about identifying for individual organisations the priority areas for attention and what questions might be important to consider when trying to improve your digital maturity going further. The report makes a number of recommendations, and as a council, we're united in trying to bring about more measurable and impactful improvements in respect to the uptake of innovation and technology in the sector. We do believe that a significant digital transformation is needed to support contemporary and adequate and quality services for individuals. We do think that the framework goes in part to helping consider our current state, but also to really see the issues involved in reaching any future states. I'd like to take the time to just acknowledge those people who were involved. Certainly we worked with a great team from the Digital Health Agency, our own great team, George, and I'll call out Georgie Gould, Frank Pearce and Emma Pearce, who all helped with this project. I'd like to acknowledge particularly Greg Alexander, who you're going to hear from shortly. Greg worked tirelessly on this project and was a great assistance to us in ensuring that the project had a number of opportunities to draw on future analysis. And of course, we worked with his early, really leading work in this area of digital maturity and aged care. But this work would not have been possible without the co-design participants from the sector. We know all of you worked with us during a time of really immense pressure on you for workforce, on financial pressure, and on pressures that are daily in the delivery of more innovative and tech-enhanced work. So I would like to just focus on those individuals who contributed and thank them on behalf of Dr. Margelis and our team at the Council for their great contribution and no doubt ongoing contribution. Many of these participants are on the line today and are continuing to help us with other projects. Thanks, George. That's it from me. I'll hand back to you. Thank you.
So thank you very much, Anne. And as noted, that report will be made available next week after we've finalised providing the scores to the individual company or providers who supported us. I'd like to now welcome Professor Greg Alexander to provide some information around from an international perspective on digital maturity and aged care. I could spend an hour doing Greg's bio, other than to say that he's definitely a world-leading expert in this area. So I'll hand over to Greg.
Thank you so much. So I just want to thank you for the opportunity to speak today, and also thank you for including me in such an important project and using work that I've done for years. It's very satisfying to have people use your work and to benefit from it, hopefully. So I just really appreciate that. And I'm going to talk to you a little bit today about building IT workforce and capacity in residential care. I've been doing this for well, really since the 2000 when I first started my graduate work. And I'm going to talk a little bit about some consensus building that we've been doing around digital maturity and how to prepare the workforce from for the future of value-based purchasing here in the United States. So currently, most of our residential care systems are on a fee-for-service system where they bill for certain services, and there are fees that they receive that they can bill for. We're moving toward what's called a value-based purchasing system, where it's really, the payment is based on quality and the ability to conduct and certain services and that improve outcomes. And so it's tied very much to the capabilities of an organization to provide better quality of care, which includes using technology, oftentimes to exchange information with internal and external providers. And so a lot of what the digital maturity items that was just discussed by Ann are being used by our country to establish baseline and trends in digital maturity to determine whether or not facilities across our country are really prepared for that future state here. Those that aren't prepared, we fear might not have great outcomes, either through their ability to sustain their systems and because their payment systems are changing. And so we're trying to prepare them for that. And in the States here, many facilities like your own don't have internal IT departments. Many of them have corporate level departments that help manage the systems. And so we're trying to understand a little bit about how the corporate world works within residential care, and also at the local level, how people understand how technology is used, because we found that there can be quite a disconnect between what happens in the corporate world at a corporate office versus what happens at a local facility in the middle of a rural setting. And so we're very interested in those perceptions and the trends. And so we've had several reports. These are major reports here in the United States by the Institute of Medicine. The most recent report, they go from left to right, and you see they started back in 1986, and they go about every 10 years up until the most recent report, which was released in 2022. And I actually sat on the consensus building committee that wrote that report. I wrote the section of the report that is related to, there are 7 overarching recommendations, and the 7th recommendation is to adopt IT in all nursing homes. And so I wrote that along with my colleagues. But I want to express that about every one of these major reports that comes out of the Institute of Medicine have actually some level of technology adoption that has been recommended. And so, but there's never really been measures of that. And so back in 2010, I began to sort of build this digital maturity survey that your country is now used and Canada is also using, and to help us understand a little bit about how these reports and how these recommendations are influencing the uptake of technology. So this is the model actually that was part of that report. It is that report is from the National Academy of Science, Engineering, and Medicine, which used to be called the Institute of Medicine. And basically, the important part of this model that I want you to see is that on the input side, on the left-hand side, in that sort of teal colored box, you'll see health information technology is called out as a specific input that would be required to improve quality of care in the United States. And it's been recommended that every nursing home strive to achieve higher levels of technology adoption that lead to better communication. And you can see in the center there those elements of care that we believe that technology impacts, along with these other items that are in that same box, including empowering staff and communication and you know, just a lot of different areas, person-centered care. And of course, all of these need to be linked to outcomes. So we're very big on collecting outcomes and reporting them publicly here in the United States. And so, but there's no reporting of any digital maturity levels in any of our resident care systems. So we have lots of outcomes. We have lots of information about facilities, their staffing, their safety, how they perform from a safety standpoint, whether they have negative events that actually harm people or events that don't harm people, but they're not safe. We actually have a lot of data around that, a lot of data around quality measurement, and all of that's reported, but there's nothing about the systems of technology that are put into place to make those things work. So that's what I've been trying to do over the last several years, and I believe what your country is also trying to do, or at least this report is. So in the United States, the reason this became really important to me was because, well, I studied this early in my career. I was studying the use of decision support in nursing homes, and around the 2008, 2009, 2010, there was some policy that came out. It was called meaningful use, which I've mentioned on other prior calls before. And what meaningful use did was paid for technology to be adopted in hospitals and ambulatory care in order to incentivize physicians and administrators of hospitals and ambulatory care systems to use technology. And that was called meaningful use again. They got millions and billions of dollars to adopt. So subsequently, all of our ambulatory care and hospital systems are really well connected. They all have a very sort of standard level of capability and they can exchange data, although we haven't achieved great levels of interoperability, but it's much better than it was before. The problem with meaningful use is once our government had decided to implement that, they chose not to include nursing homes or assisted living or home health care in that particular legislation. So what ended up happening was nursing homes were lagging behind. And you know, as you see here, that only 84% have adopted health IT, but that varies by capability. So with the report that was just given by Anne, you saw the variations in the capability. So not one system looks like another. They're all very different, and quality is quite unique depending on the capabilities that they have, and disparities can exist as a result of that. And oftentimes we find rural facilities with higher levels of Black individuals, facilities with higher minority levels are oftentimes the facilities that are left behind. So those individuals are the ones that ended up suffering from the lack of support in that area. You'll see 60% lack the ability to share data with other providers externally in our United States. And so those are important things, especially as interoperability is being promoted as the next thing for value-based purchasing by 2030 by our Centers for Medicare and Medicaid, which support and fund our residential care facilities. So they need to be supported, and you know, that's part of my work, is to try to influence that policy by showing where the gaps are. And so over the last 7 years, actually it's been 10 years, but it's taken 10 years to collect 7 years worth of national data here in the United States. I've collected data on over, you can see, you know, more than 2,000 nursing homes actually over the course of 7 years. And what you'll see here are trends in digital maturity associated with the IT capabilities that are in resident care, the extent of use of those capabilities, and the integration of those capabilities across resident care, so that integration is the internal and external ability to share data. It includes interoperability. And you'll see there's also one for clinical support dimensions, which is lab, pharmacy, and radiology. And what's really nice about this graph is that in the second national study that we did, where we trended this digital maturity over 3 years, which are the last three sort of green and teal bars, you'll see that in the clinical support section, in all three areas of capabilities, extended use, and degree of integration, there was a significant increase in the capabilities, the use of technology, and how well it was integrated. This comes after the period of time that COVID started. So there was rapid uptake of things like telehealth and the sharing of data and the support that nursing homes were being given to protect patients and stop the spread of the virus. And what happened was, we believe that there was this rapid uptake because there was no other options in order to get people access to the care that they needed when they were isolated in facilities. And then you'll also see that same sort of trend in administrative activities. And so these are important trends to keep track of. They help us understand where the gaps are. They help us understand where homes are in their journey toward value-based purchasing, which is a new model of care here. And so, and they need to know where they are and how they stand to be able to sustain their business. And so this is something that we are striving to provide. We provide feedback to every facility that fills out a survey, and they get comparisons for their own facility to national levels. We keep each individual score private, so each individual home knows only about their own scores and not about others other than aggregated data. But it is a way to benchmark, and it's also a way for our government to understand where the gaps are. And so these kinds of things are really important. They don't get collected often. They were reported in meaningful use for acute care and ambulatory care for many years, and they still are, but not for long-term care. So I saw that gap and I capitalized on it, and I believe it's going to be something really important for us to keep tabs on, not only in the US, but in other countries as well. So I have a staging model, and the staging model is another way to look at digital maturity. The digital maturity has 7 stages. And the 7 stages that are there are stage 0, which is where they have no EHR. Stage 1, where they are starting to have some disparate systems that are in place. Stage 2 they have some governance in place. And then stage 3 is where they actually have information about internally being able to share information. And then stage 4 is where they actually share information externally. So that stage 3 and stage 4 are very important demarcation. Stage 5 is where they have clinical predictive analytics, and stage 6 is for residents and resident care management to be able to use the data. So this is the slide on the distribution of the different stages that I was just talking about. And the total HIT maturity score is actually what creates these stages. So the higher the digital maturity score, the higher the stage that you have. And so each stage equates to a way to measure and compare facilities based on their capabilities. And we can utilize the digital maturity survey to help increase stages we hope, or at least that's the intention. And what you'll see here is that over the course of 3 years, you'll see that the gray bar is the third year in 2022, the blue bar is 2020, and the orange bar is 2021. And you'll see here that there was, if you go back and look at this, that there was an increase in the higher level of stages that occurred in 2022 as compared to 2020. So facilities are beginning to move toward higher stages of being able to exchange data, being able to utilize clinical predictive analytics, and giving residents access to care. There's a big push towards person-centered care and residents' goals, and providing goal concordant care, which requires us to document them and track them as people move from place to place. And so all of those rules and regulations are really shifting these bars. But the issue that is concerning is that you see that many more facilities are still at a level 3 or below. In fact, probably 60% of the facilities are still not able to exchange data. They still don't have good interoperability up to a stage 3, and only about 40% of those facilities of our total sample have the ability to exchange data and have good interoperability and utilize, being able to utilize different capabilities for the purposes of better quality of care. So we still have a long ways to go, much like you do. You see our percentages. There are a number of facilities there on the left that meet each stage. So what we've undertaken is, in order to explore how digital maturity is changing, I've done a two Delphi processes. This is a consensus-based process where we have experts in residential care who have come together and give us their opinion about workforce IT needs and what we need to focus on to improve care delivery in this sector of care. And so you'll see here that these are the content areas within the survey. There are 27 of them total, but these are the content areas that they have recommended. There's been 20 to 30 experts that complete this Delphi process. We usually do 4 rounds. We're currently in our current Delphi process, we're in the second round. So this is showing the consensus that has been reached among our experts after about 2 rounds. And what they're recommending for us is to consider the importance of IT governance and administration of clinical IT systems as an important part of preparing homes for value-based purchasing. So in other words, what this section includes are capabilities associated with how software is developed, how it's customized, how hardware is managed, how hardware is purchased, upgrades for software. It also includes tracking help IT desk issues or dealing with IT complaints and issues, and that there are specific processes and capabilities in place for doing those kinds of things in nursing homes. And then for clinical, training clinical staff on technology, and that there are actual programs for them to understand the importance of good data collection, what that data is used for, and how it's used to build better quality improvement. And the number of IT staff are all part of that as well. In this section, there is also things related to connectivity. Interestingly, connectivity is one of the areas that the Delphi panel struggled a little bit with. There was not a good consensus on whether or not we needed to measure connectivity anymore in the future surveys that we do on digital maturity. And the reason being is that because we believe that most facilities have a fairly decent level of connectivity now, and that most facilities have good internet. There are a few that don't, but the majority of them do have good connectivity and are able to at least get online, that they are able to have email, they are able to do things with these systems that will lead them toward better value-based purchasing programs in the future. So we feel like that may be an area that we don't have to measure quite as diligently in the future because it has improved. It also reduces the burden of trying to understand digital maturity because you're reducing the number of items in the survey. The other area is the digitized processes that are in nursing homes as part of that governance sort of thing, such as how is transportation managed? Is it documented how people are transported to and from a hospital or to and from a clinic or a dialysis unit, or how referrals are done? Those types of things, how bed estimation availability is done, and how people are managed when they're referred are all important things. So these other areas are pretty self-evident: the resident care management, technology and nursing care therapy, laboratory radiology, pharmacy, and residents and resident representatives. There's all areas that the panel really believes need to be continued to be people need to continue to be educated on the importance of this, and that they need to continue to be measured. This final slide, I just wanted to give you a little sense of some of the ways that we're looking at how technology is embedded in these systems, and where education about capabilities, about integration, and about the extended use of technology is important. So this is a study that we did right after COVID that related to telehealth, and you'll see all sorts of different boxes there that relate to the training of people and the tasks that they perform using telehealth, and those types of things. And you know, they didn't have that kind of training before COVID happened. We wish they did, but we just didn't have systems in place for that, and it forced us to think out of the box in regards to that. So there are many other capabilities that are very similar that Anne went over that we need to think about, rather than just implementing and seeing how it goes. We need to have a plan, at least in the United States. And so I thank you, but I'm happy to be here. Thank you.
Thank you very much, Greg, and no problems at all. And I think that's some really interesting content. And like you said, you know, a lot of this is driven from the work which goes back a decade or two now, when they first started looking at meaningful use in the US and its use in acute care. And it's obviously made a big difference in acute care. So the key is to make that happen here in Australia as well with primary care, with aging community care. So we've got a short time for questions and answer. We do have a specific question, and probably goes to Anne. Unfortunately, we missed being able to participate in the survey. When will the toolkit and the ability to benchmark be available? Sounds like some very useful information. So Anne, you'd like to comment on the availability of the benchmarking tool going forward?
Thanks, George. Thanks, Adam, for your question. We, at this stage, have only scheduled to provide those who participated in the survey with the toolkit and the ability to benchmark. The council is looking at opportunities to be able to reopen that survey, and to work with the industry again to bring in more data. We also are looking and fielding requests for local geographical areas that want to get a handle on the complexities and the positioning of the sector. Adam, it is really us being driven by funding, to be quite honest, that we would like to reopen the survey to capture those services that were not able to respond in the first round. That's complex, of course. You know, we are working with Professor Alexander and rigorous research protocols around this. So, but we're hoping that we'll have something, George, positive to respond to that question shortly.
Thanks, Anne. So the actual report itself is due for release on the 21st of November, which is next week. And included with that will be linked to the recording, from what I understand. And I think there is probably scope for another webinar down the track looking specifically at the response to this report. But the key thing here is, like I said, in the acute care sector, we saw that measuring digital maturity led to improvements in the use of improvements in digital maturity, but also improvements in the outcomes associated with that. So I think this is not just a matter of the digital maturity for digital maturity's sake, but as Greg pointed out, there is a direct correlation that's been shown in acute care, and also this strong evidence in residential and aged care that there is a direct correlation between digital maturity and quality of outcomes. We are moving to that similar value-based model. We don't know what our aged care act is going to look like yet, but the focus has been moving away from fee-for-service to a value-based model using an independent pricing authorities playing a role in that. So keep your eyes on our LinkedIn group, and we'll be emailing you. ACIITC is back. So those of you who were here in 2022, attended ACIITC in Sydney, would have heard Greg speaking about the early part of this work. The work continues, and we are back for ACIITC in 2024, March 26 and 27 at the Royal Pines Resort on the Gold Coast. We are still in the process of just finalizing the program. It's looking amazing. We've got some leaders from globally and locally involved. It'll be a very interactive conference as always. There'll be a large presence by the industry to demonstrate what's happening. It's been 18 months, almost 2 years. We'll be at that stage from our last conference. I look forward to seeing you all there. Any questions, please feel the ACIITC@aciitc.com.au. More announcements will be made in the near future, so keep an eye out both on our LinkedIn group and on your emails. But ACIITC is back, and ACIITC 2024 promises to be a major event in the sector. So keep your calendars open for those days, and we look forward to seeing you on the Gold Coast. So as always, we're always here to help. So our website address is there, our LinkedIn group is there, my contact details and Anne's contact details. We saw Greg's contact details earlier. Ongoing communication is critical for us to support the digitalization of aged and residential care in Australia. So feel free to communicate with us, and we look forward to seeing you at our next event. And make sure, again, 26 and 27 March 2024, look forward to seeing you all in person at ACIITC. Thank you very much. Thanks, Greg. Thanks, Anne, for your great presentations. And we'll speak to everyone again soon. All the best.